Well, good afternoon, everyone. My name is John Villela. I'm the Vice President for University Affairs and the Chief of Staff, and I want to thank you for joining us for our Student Town Hall. The President, his cabinet, and our faculty and staff are looking forward to our return for the fall semester. We asked students to send us questions they had in regard to the upcoming year, and over the next hour, we will be addressing the questions that were received in the email box. We know many of you have the same questions regarding residence hall protocols, COVID testing, vaccinations, mask requirements, classroom instruction, building safety protocols, our Philadelphia site, and more general fall term questions as well. Knowing we will address the items already mentioned, we will have staff that will be answering other general questions that may appear in the chat feature. This time, I'd like to turn the program over to President Ferrantino.
Thank you, Dr. Villela, and good afternoon, everybody. Thank you for joining us, and thank you for submitting your many questions. We have a lot of ground to cover in this session, and hopefully we'll be providing the information that you need. I do want to add a caution. I know that there's a lot of frustration that people feel around all of this, and I can tell you we share your frustration. What we're going to share with you today is based on our current guidance. And I can tell you that things are changing, if not every day, almost every day. We're getting new information, circumstances are changing, and we've had to adopt a couple of things even between last week and this week based on new information that has come up. The announcement by Philadelphia was a surprise to us, and we're going to report what we know about that. And all I can say at this point is that we will continue to monitor the guidance that we're getting. We're hearing things from the Commonwealth, the governor, from our legal counsel, from the Centers for Disease Control, and there are conditions, circumstances that could continue to change over the course of the next 2 weeks. And if we're put in a position where we have to update some of the things that we're sharing today, we will keep the general community well informed about what the circumstances are and what our plans are. So with that caveat, I will turn things over to Dr. Zeb Davenport, who's going to start addressing the questions that have been raised by the students. Thanks again for participating.
Thank you, President Ferrantino. And also, I would like to say welcome to everyone on the call. We're certainly glad to have you and glad to have the opportunity to speak with you. Before I kind of address the questions that I'm going to, which center around testing and the testing protocol and vaccines and things of that nature, I do want to just say that, as the president has mentioned, we have been working to do everything humanly possible to create an environment that will keep our campus community safe and healthy. And it is really going to take us working together as a Golden Rams family to make this work. And so as we're working and as you're working, if we can come together and work together, I think we can make this happen. So just know that we are working diligently on the behalf of everyone in our campus community to do our level best, even with the notion that things are always changing. And with that, I want to talk a bit about the questions that we have received around what is the campus doing to help keep the community safe. And so at this point, I'm going to talk a little bit on our testing strategy. We have actually increased our capacity for testing by adding drop-in testing clinics at our Student Health Services Center for anyone who would like to be tested. We will be conducting weekly random COVID-19 screening for all unvaccinated students. The plan, frankly, is to select 10% of the campus students that live on campus and 10% of the students that live off campus for this random COVID screening. Now, as the president had mentioned, things are constantly changing. So right now, our off-campus students, this is not mandated, but we are strongly encouraging that you also adhere to the request if you get selected to be a part of the random screening. For our on-campus students who are unvaccinated, participating in this COVID screening is required. If you're fully vaccinated, and you have uploaded your vaccination card to the MyWCU link in the email that I sent out yesterday, you will be exempt from COVID screening. Now, one positive thing to let folks know, at this point, we have already received 2,800 students who have uploaded their vaccination cards. So keep putting those cards in there so that we can identify those who would participate in the screening. And you also should know that we have created a incentive program. So for those folks who upload their vaccination status, we have two $2,500 scholarships and one $5,000 scholarship. And for those of you who are currently in the process of getting vaccinated, you still have the opportunity to receive a $5,000 scholarship as well. So we encourage you to get vaccinated. We encourage you to upload your vaccination cards in the MyWCU link in the email that was sent out the other day. If you have a medical condition that prohibits you from being screened, when you are selected, you will receive instructions on to how to request the exemption status at that time. We had some folks that wondered about it being exempt. So when you are identified to go through the screening process, that's when you can upload or inform us that you are exempt. If students test positive through student health, they will be provided a directive for isolation. If students live on campus, they will need to isolate promptly off campus. And I know for the on-campus residents, you all already know this because it's been communicated, but we just want to reiterate it to you all. You will be directed to quarantine off campus. If a student tests positive, you should refrain from coming to campus until you have been cleared by student health or your medical provider. If you live with somebody who tests positive and you are vaccinated, you do not have to quarantine. You should still wear your masks, and we recommend within 3 to 5 days, whether you are experiencing symptoms or not, to go get tested. If you are unvaccinated and you live with somebody who is tested positive, you too will be asked to quarantine at an off-campus site. Now, student health and residence life will communicate with residents as needed based on each individual case. While we can't share personal or specific protected health information, and we can't require anyone to share this information, we do encourage students to inform their professors, their employers, and anyone else who needs to know of their health status. And there may be instances where some notification is necessary, and we will work with students to make sure this notification process is followed through. If students test positive, it is your responsibility to contact your professors and make arrangements for assignments. Now, we will do everything we can to assist students in this process. So students that test positive, if you go to the website, the WCU website, and you type in student assistance, you will see that there is a faculty notification request form. You can complete that form and it will indicate and inform your faculty of your current situation. If you have questions, the folks in student health, student assistance, not student health, student assistance can help you. And our university student ombuds manager will also be there to assist you with this process. All students living off campus will be responsible for managing their quarantine and isolation. But it is important for everyone, regardless of your vaccination status, to wear masks when indoors or in close proximity to others. We can't stress that enough. Wearing masks, your sanitation, you're keeping your hands clean, those things are very important for us to help maintain a healthy environment. Now, specifically for residence halls, we had a question about the guest policy. And as the president has indicated, things are changing constantly. So effective August the 20th, the residence life guest policy is simply this. Once you've moved in and everybody, your parents, your family, your friends, whoever it is that are helping you are gone, only students living in the same building are permitted to visit you in your suite, in your room, or in your apartment. Now, This is for right now, right? Anyone who is not assigned to that building will not be permitted to visit. However, you need to know that we are continually evaluating our COVID infection rates and our guest policies, and those things are subject to change. So that kind of addresses the residents' life questions. I do want to, there was a few other questions that I just want to touch on real quickly or real briefly. We had a question about the rec center. What are the rec center hours? And right now, the rec center hours will be our regular operating hours. However, the rec center will be following the campus mask policy. And I know Dr. Osgood will talk about that in a minute. For our dining, we had a lot of questions around dining. All of our dining facilities will be in person. We're requesting students to wear your masks when you enter the space, and when you get to your designated table, obviously you would take your masks off, you eat. If you have to get back up to go get food, we're asking that you put the mask back on. So while you're in transit, you're wearing your mask. Obviously, when you're sitting down to eat, you're taking your mask off. We will be posting all of the dining hours on the facilities. We are anticipating that there may be some modifications in some of our dining operations. However, for the most part, the main dining facilities will operate as we have already publicized on our websites. A couple of other quick questions. Some folks had some questions about their IDs. If you need to get your RAM card, they will be if you live on campus, they will be distributed in the halls on move-in days. If you're not living on campus in a residence hall, you can pick up your card at the RAM Card Service Center located in Sykes Student Union. And in fact, I was over there yesterday and I saw some students picking up their RAM cards. So I know they're ready to receive students. The best thing that you can do is upload your picture to the RAM. You go to the RAM card website, RAM card website, upload your picture, and that way you don't have to stand in line to take a picture and you don't have to wait for your card to be printed. So if you upload your picture, the RAM Card Center will send you an email letting you know that your RAM card is ready for pickup and you can just walk over, but you need to take a valid ID. Question about books. Dr. Osgood, are you answering the books question or should I go ahead and answer that one?
You can go ahead and answer.
You don't want me to tag out right now, huh? All right. So a question about books. Just know that your instructors will choose course material that they believe complement what you need to learn in the classroom. You can reserve your books at the campus store. If you go to the webpage, it's wcucampusstore.com, and you can reserve your books at that point. They have actually a reservation program, which I think is a really neat program. So if you select to be a part of the reservation program, this allows you to get your books without the hassle of searching for your books during the buyback rush. They will actually package your books, put them in a box, and all you need to do is go over to the campus store and pick your books up. You can pay online for that, and it eliminates you having to stand in line, having to worry about all the rush, and it expedites a lot of time for folks. So encourage you to visit the campus store webpage, look at the reservation link, and reserve your books online at the bookstore or the campus store. And lastly, I had a question. We had a question about bringing refrigerators in the residence halls. You are permitted to bring a refrigerator from home, provided it is no larger than 3.6 cubic feet. And I think that's it. Oh, one last question. We had a person that asked about carrying your vaccination card. I would recommend that you make a copy of your vaccination card, keep your original at home, and if you need it for any reason, you have that copy on hand, but you don't want to carry your original vaccination card for whatever purposes. I don't know what you might need it for at this time, but if you want to carry it, keep your original home and keep your copy on your person. And with that, I am going to pass the baton to my trusted colleague, Dr. Jeffrey Osgood.
Thanks, Deb. And thanks everyone for being here with us today. I can tell you that we are very excited about getting back to in-person experiences this fall after 18 months of conducting all of the things that we typically do in a normal academic year over over the internet and through Zoom and through mediums like this. One of the questions that keep coming up quite a bit is, will the alternative grading policy be in place for the fall semester? And the answer is no. As we return to a more normal operating environment and a more normal experience, the university's traditional grading policy will be in place. So you can expect that. Also, there have been questions around attendance policies that are in place in classes. So professors are allowed to institute attendance policies at the course level. They must do so consistent with the university's graduate or undergraduate catalog, depending on what kind of course it is. But you can rest assured that your faculty are just as interested in maintaining your safety and welfare as their own safety and welfare, and actually the safety and welfare of their families. So you should speak to them directly if you have questions around if you're feeling ill, what would be the implications of you not going to class. We are strongly encouraging you that if you feel ill or exhibiting symptoms that are consistent with the COVID-19 pandemic, that you subject yourself to testing and find out that information quickly. But one of the best things you can do from the get-go is to make sure that you're vaccinated, as Dr. Davenport and the president have said. There have been lots of questions around, will students have an online or remote option to participate in class? As we have committed to our student population, to our university community, we are returning to a fully in-person option. And so that means that you cannot participate in classes remotely or via Zoom in the ways that you did over the last 18 months. But you can be assured that you can work with your faculty members if at any point that you are experiencing illness or symptoms that are COVID-like, that they will work with you to make sure that that you can not be penalized for doing what is in the best interest of not only yourself, but your fellow students and the faculty and all of our families. There was questions around, does the university plan on returning to remote status if we see data points that are indicating that we may need to do so? So just as we did last spring, in fact, many people will recall that this institution was the first institution to make the decision to switch to remote learning. We did so during during the spring break. And we did so without any governmental orders or governmental notice to do so. This university will continue to lead as it always has. It will continue to make decisions that are in the best interest of the entire campus community. So as we look at a variety of data points, from transmission rates to hospital occupancy rates and other similar metrics, we are prepared to make decisions as conditions demand here on the ground. And so this cabinet is constantly looking at that data on a daily basis. And so should we have to make any modifications to the instruction that we provide, we will do so. And those can range, the range of options that are available to us is a fully in-person semester, as we are planning for and will do so on August 30th, all the way to fully remote. And there are options in between. And so please rest assured that we are taking a look at all of our options based on the data and the conditions that exist on the ground. We are aware that we have a significant number of students at our Philadelphia campus, and Philadelphia issued a vaccination mandate on Friday afternoon. As the president said, this took us by surprise. We are currently reviewing all of those options with our Office of General Counsel, which is housed in Harrisburg at the State System of Higher Education. So we are taking a look at what that means for our Philadelphia faculty, staff, and students, and hope to have guidance out soon. If a student does test positive for COVID and they are required to quarantine and or receive treatment, we are guaranteeing you here that we will work with you and your professors, irrespective of any attendance policy they might have, to ensure that you can make up that work. If a professor tests positive, the university already has contingency plans for all of our courses. We have the ability to temporarily assign instructors while the professors either quarantine or receive treatment, or we'll have other methods that will allow the class to continue. So either way, if a professor tests positive, your classes will continue. The university has engaged in contingency planning on all of this. Just today, you will have received an email from myself and this Chief Human Resources Officer of this institution in implementing a much stricter mask wearing protocol that was directed by the president. This mask wearing protocol requires everyone in an indoor space to wear a mask, except when you as you see on this Zoom call, all of us are in private offices with our doors closed, and that's when you can remove your mask. Dr. Davenport can provide a little bit more information on what the dining hall situation will look like and masks in a moment. But rest assured that your masks will be required when you enter any indoor space on campus. Your faculty are already thinking through that if you're in a language class or potentially a performance class that requires you to be able to visualize the mouth, that will have clear masks associated with that or face shields, but that information and instruction will become to you via your faculty member. We need you to know that we take mask enforcement very seriously, and that a failure to comply with a mask mandate or instructions can result in you being permanently removed from your classes. This is an important public health strategy, and while we are not legally able to mandate vaccination, we are able to mandate mask wearing. And so this university is taking a very strong stance on that. You need to know that the repercussions of not complying with that mask mandate are significant. Zeb, at this point, if you give our colleagues and our students a little bit of information on what the mask situation will look like in the dining hall.
So as I mentioned, when you go into the dining hall facility, if you're moving about, we are requiring students to wear masks while you're getting your items. When you get to your tables to sit down to eat, obviously you would take your masks off. The other thing I want to mention about this is also in the residence halls. You're in your room, you're not required to wear a mask, but if you leave that to your room to go to common spaces, you should have your masks on. And I think it's important to hear that this is us trying to keep our community safe and healthy, and don't hear it as restrictions as much as it is us really working to say, how can we during this time allow for us to be back face to face, operate and function in a quasi-normal environment and still keep everybody safe. So we need your help so that we don't have to get to the requirement, the sanctions and things of that nature. So thank you, Dr. Oswald.
To that point, we know that, it's very easy for us to lose anything. In fact, we're encouraging everybody to carry 2 masks in case you lose one or one becomes, the ear strap breaks. And I even lost my keys yesterday. So it's easy to lose these things. So we are putting masks at every door, at every entrance of all of our buildings. So we're doing everything we can to make it very easy for you to have the mask that you need. So you can it will be stands and you can just walk right in, pull a mask and go. And so we're doing that to make this mask policy as easy on you as possible. I do want to tell you that the university is experiencing a number of its clinical sites, so where we place nursing students or respiratory care students or physical therapy students, or even a school district where we place our student teachers. All of those sites are not controlled by the university. They are partners with us and they are hosts of our students. And without them, we couldn't engage in the type of educational opportunities that lead to teacher certification or to nursing licensure. So their decisions are their own. And many of them are actually implementing vaccination requirements and are not providing for exemptions related to medical or religious reasons. We can't force them to do that. What we can commit to you is that if you are not able to be vaccinated related to a medical or religious exemption, we will do everything we can to find an alternative placement site. Having said that, it may be the case that we are not able to successfully find a placement site given what we're seeing at hospitals and also at school districts around mandatory vaccination for student teachers or student nurses. But we will do our best to find an alternative site. And that may mean that you have to delay your college studies, but we will do everything we can to reschedule your courses to courses that you need to complete your degree and try to keep you on time as much as possible. What we do need you to know that if you are engaged in an off-site educational experiences like clinicals, student teaching, internships, they have their own vaccination requirements We do not have any control over or authority over them, and they may be mandating vaccination without reviewing any exemptions. And actually, we're seeing some of the larger hospitals make that decision. So if you are if you are unvaccinated because of a status related to medical or religious issues, please work directly with your department so we can get on that right away. With that, I will hand it over to our Vice President for Finance and Administration to talk a little bit more about what we're doing from a facilities planning perspective.
Thanks, Jeff. My name is Todd Murphy. I'm the Vice President for Finance and Administration. And first, let me echo what my colleagues are saying. We're very excited to have you all coming back to campus. Our facilities team has spent countless hours making the campus ready for your return. So you should be excited about all the good things that are happening here at Westchester. We're getting ready to open our new science and engineering building. We're going to be having a phased in opening on that building. So the academics and then the food service. And then when you're here, you'll actually see the new parking garage going up. So that's very exciting. But with that said, I just wanted to give you an idea, what's happening in the classroom, in the buildings. We've spent a lot of time assessing all our ventilation systems to make sure they all conform to the operation standards of the manufacturer design. They've been specifically adjusted to make sure that we can maximize outside air through the ventilation systems. And we follow what's called the ASHRAE standards, which is the American Society of Heating, Refrigeration, and Air Conditioning. So you can be sure that we are following all the guidelines necessary to have a safe environment in your classroom. In addition to that, we have made sure that all the filters have been replaced so that we have maximum levels of filtration in all the HVAC equipment. In the classrooms, we're installing what's known as a HEPA filter to help for some mitigation efforts. So there'll be a HEPA filter in each one of the classrooms that you attend and in the larger gathering spaces as well. So you can be assured that we are doing an even extra level of protection for you, our students, faculty, and staff. In addition, we will also have some plastic separators available to faculty in the classrooms for if social distancing can't be totally separated within the 3 feet, that they will be available in addition as, again, an extra level of protection. We've also made sure for routine maintenance of all of our exhaust systems in all the bathrooms across the campus, just to make sure that there's proper ventilation in those areas as well. We received some questions about sanitizing and additional cleaning. So we are back to our routine cleaning in all the restrooms, all the common areas. And as my colleague, Dr. Osgood just said, we had made sure that at every entrance of the building, there will be mask dispensers located for you. So in the event that you forget your mask, one will be available to you. You won't have to go back to your dorm or your room or wherever you need to go. So they will be available. They will be maintained. So we want to make sure that they're always stocked in case that you do forget your mask. With respect to sanitizing stations, we will have sanitizing stations strategically placed along the common areas. We also have dispensers in the classroom. So as you change classes or come into class and you want to wipe your hands, you'll be able to access those as well. And they will be heavily stocked throughout the semester. And in addition, if you're handling any type of equipment or you want to wipe down the desk, those will be available to you as well. So as far as the distancing in the classroom, we'll be back to pre-COVID. So the desks will be set up as a normal classroom like you did prior to the COVID start. And we're trying to get people as back to normal as possible. Again, we are excited to have you here and we look forward to a great semester. So with that.
Right. And Todd, on that note, I think it's important that the university has analyzed not only have we calibrated all of our existing central HVAC systems in all of our buildings, we have installed air purifiers in every classroom. So that those with the combination of the mask requirement has allowed us to return to normal class sizes. So I think that's just important to say that the university looked at the introduction of those two things, the masking requirement indoors in the classroom and the air purifiers, which will allow the class sizes to return to their normal size.
Great, thanks, Jeff. So John, I guess I'll turn it back over to you.
Thank you, Todd. We had a few folks that came on a little bit later in terms of the YouTube. Zeb, could you go back over the vaccination program the incentive program that we put in place?
Sure. So we are actually going to have a weekly random COVID screening testing protocol put in place for unvaccinated students. At this time, we are going to, our plan is to randomly select 10% of our on-campus students and 10% of our off-campus students. As I said before, we cannot, at this point, we can't require off-campus students to get tested, but we can and do require our resident students who are unvaccinated to get tested. It's a weekly random screening process, and we've actually put in place an incentive program for those students who upload your vaccination card on the MyWCU link that was sent to students on yesterday. We have those students who complete their vaccination status by August the 24th, Jeff, keep me honest, you will be eligible for one of two $2,500 scholarships and one $5,000. And for those individuals who are in the current process of getting vaccinated and you're having multiple vaccinations, if you complete your vaccination by August 30th, you will be eligible for a $5,000 scholarship. Did I get the question, John? Is there something else you want me to add to that?
Zeb, that's eligible for one student who's going to be selected for a $5,000 scholarship.
Right. In a random selection process. Absolutely. One. Thanks for the clarification. That's a big number.
Good. Chris, turn it back over to you.
Sure. Thank you, John. Well, just in closing, I want to make a couple of points. The campus is working very hard to return to normal. We're excited about having students back. We have students on campus now, and I can tell you it's been a very lonely year without our students. It's probably a little disturbing to hear us talking about the circumstances under which we might have to go remote again. But let me say this, the more people we have on this campus who are vaccinated, the less likely we're going to have to go remote. Our confidence in being able to complete this semester will increase as we find that a greater percentage of our students and employees are vaccinated. So if you are concerned about our ability to complete this semester without having to switch back to remote delivery, make sure you're vaccinated. Encourage your colleague students to be vaccinated, because that is what's going to help us get through this. We are confident that this is the right thing for us to do, that we can keep the campus community safe. We believe that we have a high level of students and faculty who are vaccinated. We're working on trying to document that at this point so that we have a better idea, but making sure that the community is fully vaccinated is the one thing that we can really do to keep everybody safe, to keep the incidence of COVID down, and to enable us to get through the semester. As Dr. Davenport said, as time goes on, if conditions start to improve, then we may be able to relax some of the things that we're imposing at this point. We're going to be monitoring conditions as we go. Do everything you can to help us be successful. Get vaccinated. Make sure that you're encouraging others to get vaccinated. We're looking forward to a great semester, a great year. It's our 150th anniversary, and we have lots of exciting things planned for the year. So we look forward to seeing you all. And we're going to get over this thing. We're going to move on with our lives, with the life of this campus. And again, I can't say how excited we are to be getting back to the normal work of the university. So thank you all for being here and for participating. And as additional questions come up, please feel free to contact us and ask the questions. As I said at the beginning, if we receive additional guidance that causes us to have to make changes, we will certainly keep you informed. And with that, I will hand it back to John to wrap us up for the afternoon.
Okay. Thank you, President Ferrantino, and thank you to each of my colleagues in the cabinet for your information that you shared with us today. We appreciate everything that you're doing to keep us moving forward and get to a safe opening here. We're looking forward to have all the students back again. We can't wait to see you all in person. And there's an incredible lineup of 150th anniversary things that are coming up this over the fall semester. So lots of great things to look forward to. And with that, I think we will close out our session here today. Thank you everyone for participating, and we'll see you all in person very soon.